Welcome to the Healthy Skin Show with Jennifer Fugo, where we're flipping everything you've been told about your chronic skin issues upside down and connecting you with alternative solutions your dermatologist never told you about.
Welcome back to episode number 291 of the Healthy Skin Show. In today's episode, I wanted to talk about something known as the atopic triad, also called the atopic march. If you have no idea what that is, it is not a walk. It is not a run. It's actually this process that happens to children where they develop some form of allergies, asthma, or eczema. They start at one point and start to progress to ultimately develop all three of these issues. And my guest today, who's been on the show before, Dr. Chris Thompson, is here to share with us, especially those parents and caregivers, or maybe parents-to-be who are curious about this. Is it possible to intercede before a child ends up developing all three? Are there options? This is really crucial because allergies can become life-threatening for some. And to have a child who is so incredibly reactive to the world around them is not only difficult for them, but it's also difficult on their loved ones and caregivers. And so if we have options, let's talk about them. If you didn't tune in to the previous episode I recorded with Dr. Chris Thompson, please do so. We'll link that up in the show notes, but allow me to introduce him again. He is a Board Certified Otolaryngologist, head and neck surgeon with over 25 years of experience practicing medicine in Texas. He earned his undergraduate degree in Biomedical Engineering from Texas A&M University in College Station, and then received his Doctorate of Medicine at the University of Texas Southwestern Medical Center in Dallas. Dr. Thompson focuses solely on allergy, sinus, and nasal treatments and is considered to be an expert in all three fields. And he's excited for the future of allergy treatment through sublingual immunotherapy as more patients choose and stay consistent with this treatment. And I'll also add to this that Dr. Thompson is the parent of a child who is living with the atopic triad. So he has seen this play out in real life, not just in patients, but in his own home to his child. And so I think that brings a lot of empathy to this conversation, which I know will mean so much to those listening. So without further ado, let's dive in. Dr. Thompson, thank you so much for coming back to the Healthy Skin Show.
Yeah, well, thanks for having me back on, Jennifer. It's great to get the word out on these things.
It is, and especially because it is Allergy Awareness Month. So it's important for us to, I think, share and bring awareness to what can be going on different topics. And that's one reason why I wanted to have you back on the show and why we're releasing this episode this month, because the atopic triad, which might sound a little bit like medical jargon as I'm saying this, I'm thinking, what parent says the atopic triad? So we're talking about something that happens to usually very young children. So what is the atopic triad? And who does this mainly impact? And then we'll go from there.
Okay, sure. So it does sound jargony, and I think it's easier if we just say eczema, because most parents at least know that kids get eczema, and eczema is the start of the atopic triad. It's the first thing that kids get, and it's believed that that then leads to these other conditions like food allergy and environmental allergies, pollens, molds, things like that, and then asthma. So the triad is really, instead of three things, it's really four, because you get eczema, then food, peanut allergy being the most common, environmental allergies, again, pollens and molds, and then and pets, and then the asthma typically comes on a few years later. So it's a progression of symptoms, and they seem to all be linked to that, the first part of the illness, which is eczema.
And so is it like, is there an age bracket at which this normally happens in kids?
Yeah, it's really the first year of life. So after age 1, the likelihood of developing eczema goes down. So it's very high. Even in the first few months of life, you'll see children with eczema. And I know my youngest daughter had it. I would probably around 5 or 6 months, we started to notice that her skin was dry and itchy and bothering her. And I think that's fairly typical.
And does this impact adults too?
It does. It usually doesn't start in adulthood, but if you have eczema as a child, it can definitely persist into adulthood and be quite severe too. It's really an irritating quality of life problem to have eczema. It isn't, eczema is kind of like allergies. People don't often appreciate how much of a quality of life impact they have.
This episode is brought to you by my skincare line, DermaQuell. The beauty of these skincare products are that they are especially crafted for those struggling with chronic skin rash issues based on my research and clinical experience from my private practice. They focus on organic ingredients that are clean like zinc, aloe, and hemp oil that support and calm rashed, dry, angry skin. There's no unnecessary chemicals or additives that can further dry out your skin or mess with your hormones. And I'm so excited for you to add these creams into your routine. Check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below, and now let's jump back to the video. Well, so one thing that has been interesting to me is looking at some newer research in the eczema or atopic dermatitis field, where they're suggesting that possibly the allergies are being triggered through the skin barrier. And It might not even be what they eat. So what are your thoughts on that?
So, yes, it's really interesting as we learn more about this. And from kind of a basic understanding of eczema, there's a loss in the integrity of the skin barrier. So your skin should be a strong barrier against everything, right? The skin really doesn't allow things to penetrate it. That's its chief function, is to protect us. And kids with eczema have a problem manufacturing kind of the glue, if you will, between the skin cells. So if you imagine you've got millions or billions of tiny little skin cells, they have to be connected to one another, otherwise things can get between them. And so we manufacture proteins that glue those cells together, and it appears that kids with eczema are missing some of that, or they don't make it correctly, or they don't make enough of it, but that allows things to leak through the skin cells. And the thinking is that antigens, let's say peanut, for a good example, somehow teeny tiny bits of that may get through the skin barrier for whatever reason. I mean, there are skin products that have peanuts. Is it in the air? But for somehow it gets through the skin and then starts to create an immune reaction, because your immune system doesn't normally see peanuts coming through the skin. So it just takes us down this pathway, this immune pathway, that makes us very reactive to, of course, peanut in this instance, but then lots of other allergies begin to develop as an offshoot of that. It's almost like it turns on your propensity to have allergies when these things are leaking through your skin.
And if you develop one allergy as a child, do you find that there's this, if you develop one allergy, now you're at greater risk to develop a second. If you develop two allergies, now you're at greater risk. Is there an increasing risk the more allergies you develop as a child or even as a baby?
Yes. Yeah, that's really a good point, because in that first year of life, kids are, obviously they've already developed the eczema usually by then, but that's about when, at the later part of the first year, is when they start to develop allergies to other things, pollens and foods. And if you do develop one, you're likely to go on and develop others, which is a little bit, makes it a little bit difficult to test, because if you test children when they're young, you'll catch those allergies that they have currently, but they may go on and develop other allergies.
Okay.
Although fortunately, we can intervene, and if you do stop those allergies at a younger age, you can stop the others from developing as well. So there is hope.
I was going to ask you that. Like, is there a way to kind of swoop in? Do we have that technology now where we can jump in and kind of maybe not, and I don't know if you can entirely stop the process in and of itself, but are you able to at least mitigate some of the additional risk? It sounds like there is. So what would you do in that particular instance? So let's just say you as the parent, you're the parent and you're like, hey, I think my kid might be allergic to something. They have eczema on, a lot of times I notice like babies get eczema on their cheeks. That seems to be like a very common presentation. So they're starting with the eczema rash. There might be starting to develop an allergy. Then what?
Yeah, so you absolutely can. And I share the story of my daughter because she fits into this paradigm. She started to develop the eczema, and fortunately, being in the business, I knew what that meant and what was to come. The treatment of eczema is still fairly primitive, I would say, especially in younger kids, because they are losing that barrier a bit. You really just put an artificial barrier on. We use lots of creams and ointments. She wears gloves at night to help prevent moisture from leaving her skin. We used to have her in garments that would cover her arms and legs as well, so that, again, there was less likelihood of moisture leaving the skin, where it would get dry and crack and itch and then get infected sometimes. So from a basic standpoint, when you have a young child with eczema, these are the things that you're going to be doing: keeping the skin clean, putting garments on that prevent the loss of moisture, and then adding ointments. We go through gallons of Aquaphor. So that's kind of the most basic treatment. As the severity level goes up, there are medications that can be added to that. But the awareness is important, because if your child has eczema, you can be treating those things, but you really want to get ready for the next steps. And in our case, we got her tested here with Dr. Silvers, who you've had on, to see what she might be allergic to. And she was allergic to peanuts, and then 4 or 5 environmental allergens. Oak pollen, for instance, was one that she was sensitive to. Fortunately, her peanut allergy was mild, so we treated it by giving her peanuts. And she eventually got to the point where she now is, where peanuts are no problem.
Okay.
So in very mild peanut allergies, you can treat it that way. Dr. Silvers' expertise is in those children who can't tolerate peanuts. And there's a mechanism where you can give them tiny amounts of peanuts under supervised circumstances and get those children able to eat peanuts. So we treated the food allergies just by giving her peanuts, which was fortunate. And then we started her on allergy drops, which contained the things that she was sensitive to. So for instance, oak pollen was one of the components of her allergy drop. And by giving children those things that they're allergic to, their immune system starts to calm down and begin to ignore it, which can really stop the entire triad, right? If you can intervene early enough, you can reduce the risk of asthma, which is really the worst part of all of this, right? Is your child's starting with eczema, but you don't know that in a couple of years, they're much, much more likely to develop asthma than a child without eczema. But so few parents learn this. It's just not widely known. Obviously, if you knew that, you'd be all over it early on if you thought your child might have asthma and it could be prevented.
Yeah, absolutely. And that's one reason why I thought this was so helpful to share this information, because, there's probably plenty of people listening to this, whether they're they're going to be grandparents, or they're going to be parents, or whomever, or they're friends with someone who they can share this with to really help them know what to do. So if So what I'm hearing from you is that if it looks like your child, your baby, is starting to develop rashes very young within that first year, do you think, as an allergist, do you think it's worthwhile for the child at that point to see an allergist, or would you recommend they wait until they have some other kind of, like, it looks like they might actually have an allergy to something?
Well, I think if the pediatricians are pretty tuned into this and astute, obviously they're very adept at treating eczema, so I think that's a good starting point. I do see, though, a lot of children not going on to allergy evaluation when they do have eczema. So it's probably a good idea just to put a bug in the ear of your pediatrician and say, this is eczema. I've heard that it can go on to other things and that there may be some allergies that we can even identify now. I think that's a good time to transition and get a referral to an allergist. But most of the time it starts with the pediatrician because moms will bring their kids in with the skin rashes to the pediatrician. So I think that's a really good place to start.
Okay.
And then mentioning the fact that we want to see if we can stop this from going on to the other bad things.
Yeah, because can you, just in terms of asthma, like my sister, when she was younger, had an inhaler, which she eventually, thankfully, outgrew and no longer, I don't think, really has a need for an inhaler anymore as an adult. But what is the issue? Is it that the allergens cause a constriction where the lungs can't breathe appropriately? So for a parent who might not be too familiar with asthma beyond like the kid needs an inhaler, what exactly is going on with asthma?
So all of this is inflammation, right? It's all about inflammation, and whether it's the allergies, food or environmental, or whether it's asthma. So the child gets off to a very allergic, inflammatory start with eczema. And in the lungs, when there is inflammation in the sense of getting asthma, the airways or the muscles around the airways start to constrict. So we have little muscles that surround the tubes that allow us to bring air in. And those are there to protect us if there is something, let's say there's smoke or something in the air. Those clamp down to limit the exposure. Well, they get a little bit off track when the patient is allergic, and they start to fire. Those muscles start to constrict all the time, and you get the classic wheezing, restricted breathing. And the medicines that you referred to that your sister was taking probably were designed just to relax those muscles so that the airways could relax and open up and bring air in. That would be a rescue inhaler where you just use it when you're having symptoms. And then children with more persistent asthma would take a different type of medicine involving a steroid that calms the immune system in the lungs so it doesn't react so much. And it really can make a big difference, not just at the time, but long term. If you don't treat that, those muscles get bigger and bigger and bigger, and the airways get narrower and permanently get damaged. So it's important to treat asthma early and aggressively so that you can prevent that lung damage that may ensue if you don't treat it.
Okay. Oh my goodness. That sounds kind of scary, actually.
Well, again, I think with awareness, though, it's not difficult to treat.
Right.
And I know firsthand, my daughter has asthma. We have to use that steroid inhaler a few months out of the year, and she's great. And I'm obviously concerned that her airways would, we call it remodeling. They may change with time if you don't treat it. So we try and get on it as soon as she has those symptoms.
And in terms of medication, I assume there's a spectrum of things, especially for allergies. We talked a little bit about like how, especially with adults, sometimes adults are left on certain medications for too long. I did want to just also touch on like an EpiPen. How do you make the determination whether a child actually needs an EpiPen or even an adult?
So typically that's going to be used for food allergies. Again, most commonly peanut allergies, but other food allergies, milk and wheat and other nuts. because those can result in what's called anaphylaxis, where you go into shock because of the super high levels of inflammation that occur when you get exposed to whatever you're allergic to. We don't see that level typically with environmental allergens, the pollens, the cedar, dog. I mean, you can get very ill and it can trigger asthma, but we typically don't recommend EpiPens for those situations. So it's mostly for food allergy or maybe venom allergy, bee stings, wasp allergies, those sorts of things can also cause really severe episodes of anaphylaxis.
Okay. And so your allergist would help you determine whether that was appropriate for your case.
That's right. That would involve some testing, and the testing tells you what you're allergic to and how severe that allergy is. And obviously, if it's on the severe spectrum, that's when we get a little more aggressive with treatment.
Yeah. Yeah. Because obviously we don't want to go into anaphylaxis. That is not good. Not good.
No, it's no fun to go to the emergency room.
No, it is not. So I wanted to ask you about this FDA news release that I had stumbled across, I think sometime last year. It was after you and I had spoken. And I thought it underscored the interesting point of why, sometimes we have to have awareness that there can be risks to all medication, right? And this was really surprising to me. It's entitled, and we'll link this up in the show notes, FDA requires stronger warning about risk of neuropsychiatric events associated with asthma and allergy medication, Singulair, and the generic Montelukast. Can you talk a little bit about what is going on here? I know you had told me before we started talking, this isn't like new news per se to someone like yourself as an allergist, but it definitely took me back because I wouldn't have guessed that there would have been necessarily, that's neuropsychiatric event sounds a little scary. So what is going on here with us?
Yeah, well, I think that's precisely why they came out with this requirement for a stronger warning, because Singulair or Montelukast is widely prescribed. It's been around for a long time. It's used by a wide variety of physicians, and I think that we could probably do a better job at educating patients that there is a rare risk of developing depression, even suicidal thoughts as a result of taking this medication. It's an allergy medication, right? You wouldn't even consider that to be a potential issue with it. And again, I think because it's been used for so long and this is a rare side effect, that we as physicians may get a little lackadaisical and not explain that. And so in that rare instance, a patient probably isn't going to think that, oh, this is my Singulair that I started taking last month. And they won't know to stop it. So I think it's just a little bit of a wake-up call that says, hey, discuss this with your patients. If you start someone on Singulair, just mention it's super rare, but if you start to have these sorts of thoughts, it's probably not a coincidence.
And so is this, just from your experience or what you've read, is it something where, like you mentioned, maybe you've been taking it for a month and you noticed you're starting to feel depressed, or is this something that could be an onset if you're on it for like 2 years?
Yeah, I'm sure it's possible, but usually it's going to be something that's going to come on fairly quickly. I would think, first few weeks or months is when you're going to see it. Obviously, if you're taking it, you might consider it, because if it's mild, it may be something that you've just, learned to live with, and might be something that can go away if you just stop the medication.
And obviously, any prescription medication, and I always say this, I learned this from my dad, who is a doctor. Before you stop any of your meds, talk to your doctor. So obviously go back to your allergist or whoever prescribed the medication before stopping it. But if someone is on Singulair or Montelukast, are there other options for them if say this is happening to them, they're getting this side effect? Are there other medications that they could possibly trial that are sort of similar but don't have this impact?
Yes, yeah, definitely. And it isn't a medicine that's dangerous to stop right away. So if you were having these problems, it's safe to do that. But yeah, I would definitely let the doctor that prescribed it know that you're having this and that we need to look into alternatives to that one.
Yeah, it was just so wild. And the one thing that was funny, I noticed the date, it was March 4th, 2020, and it was like right before the world stopped. It's almost like we just were like, oh, whatever was going on, we forgot because everything shut down. And I think that's probably one of the reasons why like I didn't pick up on it and other people, it just wasn't something that I think went probably beyond physicians. And I know that my audience likes to be a little bit more in the know and at least have some idea of whether they could ask questions about certain medications and whatnot. And so I think it's just a good reminder that all medications have side effects. They all do, even things over the counter.
Right. Yeah, and strange ones sometimes too, right? Like this, it's not drowsiness. It's a very odd symptom to have from an allergy medication.
Well, before we wrap up, and especially because you're a parent of a child who has dealt with, actually, it sounds like the atopic triad, or perhaps avoided parts of it.
Right.
What would you want a parent to know if they're coming to your practice and they're nervous about what's happening to their baby or their child? What would be something that you would want them to know? Having been in their shoes?
Yeah, I think the main thing to understand is that there are things that you can do to treat this beyond just treating the eczema, because that's what the first symptoms are. And I think that's what typically happens. I think they treat the eczema with the things that we've discussed, and they think that's kind of all you need to do. But the fact that we're talking about the triad, the progression of the disease, it's really important to understand that, because if your child has mild eczema, they have a 20 to 30% chance of developing asthma. If they have severe eczema, it's upwards of 70% of those kids are going to go on to develop asthma, and you can intervene. You can do something to stop that. And I think that's the main message, that we need to get out there. It's just not out there.
Yeah.
Even among some pediatricians that I speak with, I think it's really important to understand that there are things that we can do.
Absolutely. And it's nice to be able to talk to both sides and share with both parents and with doctors and other practitioners as well, just to have awareness about this. Because I also too, like, I don't have children, I don't work with children, and I wasn't honestly aware that there was that high of a risk, like especially with severe eczema. I didn't realize that. So it underscores the need not only to have awareness, but to take action, not to let it go and necessarily see if the child will grow out of it. It sounds like that's probably not the right approach, especially if it's in the first year of life.
I think that's exactly right, Jennifer.
Well, thank you so much. I know that your practice, do you want to tell everybody, you have an interesting setup at Aspire Allergy and Sinus. You have like multiple offices and a lot of different physicians, I believe, that work in your practice, correct?
We do. We've really grown a lot over the years, mainly, I think, because we offer a wide variety of treatments. We've combined ear, nose, and throat doctors like myself with allergists and immunologists. So we've got kind of everything at the same place. So yeah, we've grown quite a bit. We're in 65 locations now, and
oh my gosh.
We're very good at stuff like eczema, asthma, and allergies.
That's awesome. Well, thank you so much for joining us again today. We'll put all of the links so everyone can find you and the practice in the show notes. And especially if they're looking for some help, I know that you're located in one area of the country of the U.S., but I also have it has been known that some of my my listeners will travel. So
yeah, that's right. We're in, I think, 5 states now, so we're getting out there. Hopefully we're close enough.
Perfect. Well, thank you so much, and I really appreciate your time.
Yeah, me too. Thanks for helping me get the word out.
It's been one of my missions since last year to start increasing the amount of content that we share about allergies, because allergies are intimately connected with some of these skin concerns. I'm hoping that this episode will help to inform and empower you as a parent, as a caregiver, a would-be parent, or maybe a concerned aunt, uncle, or friend. And so if you want to check out any of the information we discussed, especially that FDA warning training on the singular issue, you can head on over to skinterrupt.com/291. And you can also leave your questions and comments there so we can keep the conversation going. And this is also a great episode to share with your fellow parents, parents-to-be, caregivers, to help them know that there are options, especially if they're starting to notice this trend in their child now. Now seems to be the time, right? Because there are things that can be done to intercede and possibly improve the quality of life, as well as reduce the reactivity of that child. So make a point to share this episode with those you know who could really truly benefit from this information. And if episodes like this have really helped you, please take a moment to rate and review the Healthy Skin Show and then hit the subscribe button. That way you never miss a weekly dose of inspiration, new research, all sorts of alternative strategies, and clinical pearls to help you on your journey to rebuilding healthy skin. And then let's connect over on Instagram. I'm at Jennifer Fugo. Thanks so much for tuning in, and I look forward to diving deeper with you in the next episode.